as published on nondetail.com.
Are we collectively learning and collaborating enough against COVID-19? One advantage that gives us an edge over the virus is that we can communicate, comprehend, and collaborate. But, unfortunately, it appears that we are not doing as much as we should be doing. Israel data on vaccine efficacy dropping to 39% after 6 months was out little after mid of this month. Building upon which I have estimated that it's a warning sign for the US, since it's the same Pfizer vaccine. And even the US, like Israel, vaccinated most of its residents in the early months of the year, so I estimated that the immunity might be fast fading now. Which explains why we are seeing rising cases in the US now. I will share the video link in description wherein I discuss this analysis in detail. And my analysis is proving to be correct. A preprint article has come out now which tells exactly this. Even WebMD.com has covered this article. Yet, it is unfortunate that the US CDC in its latest issue has not covered this. It has merely said that the vaccine appears to have lower effectiveness against confirmed infection and symptomatic disease. Earlier, we were talking about efficacies in the range of 80% to 95%, and when we say it's lower now, who would imagine it dropped to as low as 39%? Plus, the US CDC appears to have published outdated efficacy numbers. If a trusted agency like the US CDC is slow in updating and publishing the emerging reports, then we are not efficiently learning from each other's experiences. You might remember how in the beginning of this pandemic the US CDC did not recommend the masks. While the data from other countries like South Korea was telling us that masks do work. Find the related article link in the description. I also remember arguing that it would be the US after Italy which would get impacted by COVID-19 and not India. When many of us were fearing that India would get devastated by this virus due to India's poor healthcare system. It was not very tough to estimate this, especially when we saw how the virus took over Italy's Lombardy region because Lombardy traded heavily with China's Wuhan region for its fashion industry needs. Similarly, America is the largest trade partner to China and there is a lot of physical movement between these countries. So, it was no-brainer to expect that with trade even virus will find its way. Whereas, between India and China the physical movement is very limited for legacy reasons. So, the virus had to find its way to India via Europe. Now, listen to Dr. Anthony Fauci.
2 months ago, 60 days ago, the CDC came out with the recommendation that individuals who are vaccinated do not need to wear masks indoors or outdoors. Something has changed, and what has changed is the virus. The CDC hasn't changed, and the CDC hasn't really flip-flopped at all.
He is sounding as if the Delta variant is very new and the virus has changed just some days back. World has seen what Delta variant did to India. We all are seeing what Indonesia is going through. Forget the Asian countries, the emerging world. We have seen the Delta variant upsetting the UK opening up plans. I have done a detailed video on Delta variant and whether India is heading towards the third wave. Find the link in the description. If an individual without a science background like me has been able to derive and estimate all of this, days and months ahead, why are these agencies with all the expertise and tools sound so lagging? The US shouldn't be sounding surprised at all. If I was able to estimate that the US would see numbers rise again way back in May to June, how come the agencies with all tools and expertise at their disposal are still sounding surprised? At the beginning of this video, I have mentioned about our one strength against the virus, and now before I end this video, Let me also tell you about one advantage that the virus has when compared to us, and which is, the virus has not yet created its God and the associated rituals.